to Let's Talk About Super Special Kids and Cake, the podcast for parents of children with special needs. We're coming to you from the studios of Sacred Heart University in Fairfield, Connecticut. This podcast is brought to you by our book, Let's Talk, Navigating Communication Services and Supports for Your Young Child with ASD, published by Paul H. Brooks and available from Amazon.com. I'm Dr. Rhea Paul, a speech-language pathologist and professor here at Sacred Heart, and I'm here with my colleague and friend.
And I'm Dr. Donia Fahim, also a speech and language pathologist and the founder of Education and Therapeutic Spaces, an international consulting company for children with special needs.
We have these professional titles, but my favorite title is really Granny Rhea, because I'm lucky enough to have a beautiful little granddaughter.
And I love being Auntie Donia, and I'm blessed with 5 nieces and nephews and godchildren who all live in London and Cairo.
Each podcast, we'll talk to you about a topic we hope will be of interest to parents and families of super special kids. We'll also answer super special questions sent to us by our listeners. And we'll share our thoughts on some common misconceptions about super special kids and things that make us go, "Arr!"
And there will be one more part to each podcast. As you know, Granny Rhea, I say there is nothing wrong with eating cake for breakfast. And our last segment is all about activities you can do with your super special kids that are as much fun as eating cake for breakfast. We'll even eat some cake for ourselves. So now would be a great time for you to get yourself a cup of tea, maybe grab a slice of cake, relax, and listen to our theme music composed by the New York musician Marty Eisenberg. Our super special topic of today is assessment.
Assessment means finding out what a student or a child can do, what's hard for them, what their strengths are. And in some cases, it means finding out what the best diagnosis for the child may be as well.
So when you see that your child is having difficulties, perhaps with their language, with their learning, with their attention, that's when you're going to contact your health practitioner, so your general practitioner, your doctor, for further assessment. And more than one person will typically assess your child, particularly if a diagnosis is needed.
Yes, and it depends on what developmental stage your child is in, too. For very young children, where we're just trying to find out an initial diagnosis, does this child have autism, or does this child have cerebral palsy, or whatever the question may be, that question may be answered by just 1 or 2 people. But as children get older and have a broader range of needs, for example, they may have needs with their motor skills, perhaps they can't walk or use their hands very much. They may have trouble with their language skills if they can't talk or are hard to understand, or they may have trouble with their cognitive skills, being able to learn when it comes time to learn to read, and so on. So those kinds of problems generally will be addressed by a somewhat larger group of people. So let's talk about some of the people that might be there, Auntie Donia.
So you may have speech and language pathologists like myself and Granny Rhea, and we would be looking at the children's language, their communication, their articulation, their social communication, and sometimes as well their feeding. An occupational therapist may be involved to look at their fine motor, gross motor and sensory processing. A physical therapist may be involved to look again at their gross motor functioning, fine motor functioning. And then, of course, colleagues such as psychologists, clinical psychologists or educational psychologists. Often a psychiatrist may be involved, but a paediatrician would always, I think, be involved as well. Because as Granny Rhea said, we're looking at assessing the overall abilities of the child. So that's their learning and educational needs, but their medical needs also needs to be looked at and addressed as well, to really make sure, especially if we're looking at diagnosis, that we're not missing any underlying reasons why the child may be having difficulty.
Yes, that's really important. And parents, I'm sure this is a hard process for parents, especially the first time you go through it, because there's all these people looking at your child and trying to find things wrong with them, right? That's really not what it's about, although we know it may look that way to you. Again, we're trying to find both strengths and weaknesses, things that we can build on that will allow us to move the child forward in the therapeutic process.
I know from my work with parents, often one of their concerns is that the assessment process can take a long time. And as you said, Granny Rhea, it's really to better understand the child's strengths and needs in order to then support the child with regards to the best intervention that would be needed. And sometimes there are what we call standardized assessments that are used. So these are assessments where they would be a comparison of what your child is able to do compared to other children, and your therapist or the specialist that's working with your child would be able to explain to you what those test scores mean and how your child is doing compared to other children their age.
Yeah, and it's really important for you to understand what those test scores mean. And sometimes it can be confusing. Generally, when you get a test score, you will be told what percentile your child falls in. And a percentile means that your child is scoring at or above the level of what percentage of a typical population. So let's say you hear that your child gets a score at the 36th percentile. That means that 36% of the children taking the test would score at or below the score that your child got. And that may not sound so good. 36%, that's not at the very top, but it is within the normal range. So it's important for you to understand that a score that might sound low might not really be as low as you think it is. And so the solution to that problem, I think, is to ask. Make sure you understand what the scores mean before you move on to the next topic.
And when the assessment is being conducted, the specialist seeing your child will also ask you, what does your child do in other environments? Because, of course, when they're coming to the clinic, or even if the assessment is taking place at home, it's a slice of time for your child, your child for that particular time. And so it's also important for you as parents to share, where do you see other strengths and areas of need that would actually also inform the diagnosis and the intervention plan too?
Yes, and the standardized tests will take up a pretty large portion of your assessment time, but they shouldn't take up all of it. Be aware that clinicians and therapists and teachers learn a tremendous amount about children from watching them do natural activities. Natural activities like play, like eating, like putting their coat on and taking it off. Those things are part of the assessment too. And you want to make sure that your team is providing you some information about what they may call more informal evaluation methods. But just because they're informal doesn't mean they're not valid. They're a very big part of understanding, again, the strengths that your child brings to the educational and therapeutic process. And we want to make sure that people have those in their line of sight so they can use them for designing an appropriate therapy program.
The other part of assessment is looking to see how you can prepare both yourself and your child for the assessment, whether the specialist is coming to your home or you're going to the clinic. If you're going to the clinic and you've got a younger child, it's a good idea to take some of their favourite toys with them, to have a little snack for them. And one of the things I sometimes suggest to parents is they show a photograph of the person that they're going to see, so that they know they're going to see, Rhea, or they're coming to see Donia, and that seems to help as well. And then for you to know too that you are going to be seeing your child or observing your child doing things that can be difficult for them, and that can be uncomfortable. So just knowing that that is something that may come up as well.
Yeah, and I can't stress how difficult it is to watch your child fail at something. I've worked with so many parents that are just heartsick when they watch their child take a standardized test because they see there are things the child can't do. Standardized tests are made to to present your child with things he can't do. That's how they're designed. You have to get to the point where the child can't do things before you can decide that this is their ceiling level of performance. And for many of our kids with special needs, because their development is not a flat line the way most kids is, they have high points and they have low points. And sometimes that means we have to test even longer past their low points to see if there are a few high points left that we haven't found yet. So I would really encourage you to, as you watch your child taking a test, remember that we're trying to find as many strengths as we can, and sometimes we have to go through a lot of weaknesses to get there.
And if you'd like any additional information with regards to the different assessments that are used, the professionals who may assess your child, please have a look at our book. Chapters 1 and 3 cover these topics.
And one final word is that you will probably get some kind of report about your assessment. Sometimes these reports can be very long, dauntingly long, and you take a look at this, 20-page novel you've been given about your child, and you sort of, your heart sinks. Read it a little bit at a time. Read it slowly, read it with a partner, and try to discuss between yourselves what you think it means. And by all means, if there are things you don't understand, or even more important, that you don't agree with about the report, get in touch with your team and have them talk to you about why these misperceptions or mismatched perceptions might be taking place. You need to understand your child. This document is for you, and it belongs to you, and you have a right to really have a deep understanding of what's in it, and you have a right to ask. And there's no reason to expect yourself to understand every word of it the first couple of go-rounds, because there is a lot of technical language. Even though we try to be as jargon-free as we can, there's a lot of numbers and things that might be unfamiliar to you. That's nothing to be ashamed of, but take the time to ask. You have a right to know.
Our super special question for today is, what is the difference between verbal and non-verbal abilities on psychological assessments? And this is a question that a parent had recently asked me, Granny Rhea. Their child is talking, but the psychologist had said to them that their child has a cognitive delay. And this was very confusing to them.
Well, it's a great question, and I'm so glad you had the opportunity to talk with the parent about it, Auntie Donia. Very often on standardized psychological tests, or what are sometimes called cognitive tests or IQ tests, there are at least two different kinds of scores. One score is called a nonverbal score. It may be called a performance score or a visual reception score. All those three things, nonverbal, performance, and visual reception, mean the same thing. They mean being able to solve problems without using words. And then there is usually another section on a psychological test that's called a verbal section. I don't know of any other names for the verbal section, Auntie Donia.
Yeah, that's right.
Yeah,
verbal
just
section.
verbal. Okay. So the verbal section will usually contain questions about what your child understands about words. What words do they know? What pictures can they point to? What sentences can they identify? What sentences can they repeat? Those are all verbal kinds of tasks. The nonverbal tasks, on the other hand,
so they could include things like puzzles, so being able to do a block design, being able to copy a shape. So that's being able to solve problems that don't involve, as Granny Rhea said, language.
Right. Now, the examiner may talk to them while this is going on. It doesn't mean that that both the child and the examiner are mute. What it means is that the child isn't required to understand very much language, and the child isn't required to produce very much language in order to get credit for those items.
So an example that I like to use for this is the children who are able to follow the Lego books in order to build a very complex Lego design. And because the visual is there, they actually look at the images and they can follow that accurately. But if that image is removed and they're asked instead to verbally follow those instructions, that can be more difficult for them.
Right. So it would be like you're saying now you have to put the small green square on top of the big yellow square and add it to the right of the purple square. That would be much harder for many people, both with and without disabilities, than just looking at a picture and matching what's in the picture. But the two skills are different. Some have to do with spatial relationships, with being able to remember visual images, and others have to do with being able to remember words and sentences. So they are testing two different kinds of skills. Most normally developing kids are pretty much on par, both verbally and non-verbally. But lots of otherwise typical people aren't, and I'm a prime example. I'm pretty good with words, but I'm terrible with visual problems. When I get into an elevator and I come to another floor and I have to get out, I have no idea which way to go. I just have no spatial memory.
And I was actually sharing with Granny Rhea that I'm the opposite. Although I have language and I love using language, but my visual processing and my abilities to do puzzles, to remember, I mean, I could draw a map for any country I visited and sort of visually show you where I've gone. I can solve problems visually, and that's much easier for me than recalling facts.
Right. So many people have discrepancies between these two skills as well as between among other skills that they might have. But for kids with special needs, the reason we really probe into this particular discrepancy is because it has implications for their performance in school. Kids may be great at visual problem solving, but that's not going to help them as much in school as verbal problem solving will, even though their skills may be absolutely superior in that regard. They may still struggle in school because of the verbal relative weakness. Now, it doesn't mean they can't talk. It doesn't mean they can't put together an ordinary, everyday sentence. But it may mean that understanding complex, unfamiliar, long verbal information may be much more difficult for them than doing things other ways. So that's why psychologists tend to explore this difference, because it helps us figure out what kinds of support is the student going to need. For instance, we know many students with autism benefit from some sort of visual support.
That's right. And children, children with autism, but as you said too, Granny Rhea, there are children that may have that discrepancy and they don't have a diagnosis of autism. So representing the sequence of what needs to happen can be very helpful, as much as possible using graphic organisers for the children who are having difficulty organising their information and understanding these sort of more abstract concepts can be very helpful as well.
Yeah, so if you, for example, have your child assessed and you are told that the child functions at the 50th percentile, which means right in the middle, just where he should be in terms of nonverbal skills, but at the 15th percentile in terms of verbal skills, that tells you that you're going to want to try to support that child in any kind of verbal activities that are required in school. And you may want to advocate for some visual supports in doing that.
That's right. And just, I think, for things that you know that you can do at home as well. So let's say, for example, this is impacting your child's ability with numeracy. Doing things like setting the table. So for one-to-one correspondence, so saying there are 4 of us that are going to be eating today. How many plates do we need? How many more plates do we need? And that's a nice way of visually supporting the child, but also using the language to help them too.
Right. So when you have a child who is weaker in language than in other areas, what you want to do is give him things he can do with lots of visual opportunities, but then always build the language on top. So he's hearing from you over and over again every day. We need 4 forks, 1, 2, 3, 4, as you place the forks at the 4 different places on the table. So those are the kinds of ways we can use this information about discrepancy to support children in their growth.
So Granny Rhea, what is the thing for this segment that makes us go, "Arr"?
Well, in my book, Auntie Donia, something that really disturbs me, that's an issue these days, is what we call people with disabilities. It's a big issue in autism, as you probably know.
That's right. I mean, when I first qualified, it was really important that we didn't use the term autistic, that we said the child with autism or the child with special needs. And there has been a more recent trend where instead the autistic community are saying, actually, no, we would prefer that you say we are autistic. And it's interesting because in the UK, the National Autistic Society has always been the National Autistic Society. So I've seen also changes that happen kind of cross-transatlantically as well.
Yes, and in many other communities too. For example, I was involved in a group doing research on language and deafness. And of course, like Auntie Donia, when I was in training, we were taught you never say a deaf person, you always say a person with deafness. You never say a stutterer, you always say a person who stutters. But now the deaf people are saying, no, we want you to call us deaf. That's what we are. We're not ashamed of it. We're proud of it. We want to be called deaf. So I was writing a paper with some of these people and had very carefully put in people who are deaf at every point. And they said, nope, take it all out. You got to change it back to deaf. So the communities that are most touched by these issues feel differently about it than perhaps those of us who are outside.
And I will often ask the person that I'm working with, so if I'm working with an adolescent or an adult who obviously has a diagnosis, I will say to them, how do you like to refer to this? And I really think ultimately it's about respect. It's respecting the individuals within a community, and I think that's at a level of humanity. That's not just particularly for individuals with disabilities. I think that's across the board.
You're absolutely right, Auntie Donia. I mean, certainly the key to all of this is respect, but sometimes it's just hard to know how to express your respect. You want to express it, but sometimes it's hard. So I would encourage parents to think about this issue for yourself and decide, how do you want your child referred to? Maybe your child isn't ready yet to make his own decisions, but how do you feel? Would you rather have someone say your child is deaf or that your child is someone who has deafness? You count. And your feelings count. And whatever feels best to you is what you have the right to ask people to do.
I think that's such an important point, Granny Rhea, that it's individual, that each person can decide how they like to have it described and addressed.
And of course, we like to have societal norms because it makes it easier for us. We think we know what to do, but it's very easy to be wrong in situations like this. So I would just encourage parents to think for yourselves about what a label might mean to you. Maybe you don't care. Maybe it doesn't matter to you at all. You're not insulted by whatever people say. But if you do care, you have a right to tell people and to ask them to respect your needs in this area. So, Auntie Donia, you're always in favor of eating cake for breakfast. What's the cake we're going to eat for breakfast today?
So our eating cake for breakfast today is one of my favourite ones, and it's jumping in puddles.
Puddle jumping, yay!
Exactly. So get your wellies on and jump in the puddles. But there's a number of reasons why I really love this as a simple activity. So for typical children, it's something that they love. I think there's almost like a naughtiness in it. Like they know that maybe they're not supposed to. So allowing them to have their wellies on, jump in the puddles, I think is just something that's fun. And I would say to you super special parents out there to try it too, because I know that when I have fun with my nieces, nephews and godchildren, it makes the world of a difference. But I have a little story to share with you, Granny Rhea.
Oh, good.
There was a little boy that I was working with who does have autism, and every time he saw water on the pavement, he was actually afraid to go over it, so he would sort of walk around it. And functionally, this became quite difficult for his mum. Living in London, it rains quite frequently, for her to have to avoid the water on the road. So slowly, we started by him just like putting a little foot in the water, and then he would go around it. And then eventually, it was so delightful to watch. He then loved actually jumping in the puddles. And then his mum said to me, that's all he does now. He just wants to jump in puddles.
Well, we don't want that either. It reminds me of when my kids were growing up. We lived out in Oregon, where, again, it rains all the time and there were always puddles. And I always felt bad that the kids can't go outside and play. And then I would look out the window and I'd see other kids outside and playing in the pouring rain with their little boots on. And I said, well, why not? And I used to take my kids for puddle walks a couple times every week, where we'd all put on our rubber boots and see how many puddles we could find in the course of our walk through the neighborhood. So I kind of got educated by that experience. But of course, we're not just talking about jumping in puddles, literally. We're talking about doing things that other kids might do kind of behind their parents' back when mom and dad aren't looking. And we don't want our super special kids to have to miss out on all those experiences just because we do have to watch them more carefully and have to provide a bit more supervision than we do for their siblings. So we'd like to just encourage you to think about what you did as a kid that was really fun, that maybe your parents weren't 100% behind. Do you have any thoughts about that, Auntie Donia?
I was just thought as you were saying that, Granny Rhea, that, some of the super special kids that will be listening may not have many puddles to jump in because they're living in countries where it doesn't rain very often.
Right.
And so it could be that, walking on the grass barefoot. It could be sort of, watching the palm leaves or picking dates from the palms. It could be walking in the sand. So there are other activities that are sort of everyday things that, as you said, Granny, I think it's things that typical children will do and parents may sort of discourage or encourage them to do, and things that we want to expose our super special children to as well.
Yes, I remember when I was a kid, one of my absolutely favorite things to do was to go to the top of a little grassy hill and lie down on my side and roll down. It was heaven. I was in ecstasy. I don't know whether my parents ever saw me do that. If they had, I don't know whether they'd have told me to stop. But it was just something that brought me so much joy. And I hope that our super special kids get the opportunity to experience that too, both in activities that they discover themselves, but also in activities that perhaps they're introduced to by parents and siblings who want to share things that have been enjoyable for them. I think the point is that we want our super special kids to be kids. We want them to have all the great experiences that childhood gives us, which unfortunately, when we get older, we lose the ability to enjoy as much, but they remain as very precious memories. So we just encourage you to find things that your kids really love to do and find ways for them to do them.
Now, Granny Rhea, it's our favourite part of the segment, which is when we get to try some cake.
Oh, this looks fabulous. What have we got, Auntie Donia?
So today we have a home-baked cake baked by my dear friend, Deb, and it's pumpkin spice with pecans and walnuts.
Oh, yum. And it is gluten-free.
It is
so
gluten-free.
You can eat it, right?
It is gluten-free.
Okay, let's have some.
Oh, and I was just going to say that I love that it's also egg-free.
Is it really?
Yeah, it's egg-free as well. The egg replacement is flaxseed.
The Let's Talk About Super Special Kids and Cake podcast would like to thank our host, Sacred Heart University's School of Communication and Media Studies. We'd also like to thank our composer, Marty Eisenberg, our audio editor, Brent Morton, and our audio engineer and director of cake-based operations, Keith Stryovi.